Hi everyone, I'm Sanjana Nagraj, and today I have Dr. Joo-Yong Hahn, who is a professor at Samsung Medical Center in Seoul, South Korea, and who presented on Clopidogrel versus aspirin for long-term maintenance monotherapy for patients who are at high ischemic risk after PCI. Thank you so much, Dr. Hahn, for being here. We really appreciate your time, and it's a pleasure to have you here.
My pleasure. Thank you.
So we'll delve right in. So I would like to know, what was your motive for conducting this trial?
Aspirin monotherapy has been recommended as a standard treatment in patients undergoing PCI for lifelong management. However, data supporting aspirin monotherapy are outdated and debated. Therefore, clopidogrel has been emerged as promising alternative to aspirin monotherapy. So far, only one trial directly compared clopidogrel monotherapy with aspirin monotherapy in patients undergoing PCI for lifelong management. Therefore, another large randomized trial is necessary to confirm the strong evidence for clopidogrel monotherapy in patients undergoing PCI. Therefore, we conducted Smart Choice 3 trial to compare clopidogrel monotherapy versus aspirin monotherapy in patients with high risk of recurrent ischemic events undergoing PCI and who had completed standard duration DAPT.
Thank you. No, that is definitely a very important question that, it comes in daily clinical practice. I would like to know a little bit more about who were the patients, what was the criteria for being considered as high ischemic risk for recurrent events?
In our study, high ischemic risk was defined as previous MI, medically treated diabetes, and complex PCI. So, and patient had to have no severe events after PCI. We enrolled a total of 5,506 patients at 26 sites in South Korea. The primary endpoint was composite of death, MI, or stroke.
Very nice. Thank you so much. So I would like to know, what are the key findings that you found through this trial?
During a median follow-up duration of 2.3 years, the cumulative incidence of the primary endpoint was 6.6% in the aspirin monotherapy group and 4.4% in the clopidogrel group. The difference was statistically significant, and the hazard ratio was 0.71 and NNT was 45. The benefit of clopidogrel monotherapy was mainly due to reduction in recurrent myocardial infarction. There was no significant difference in the risk of bleeding between the two groups.
Got it. Thank you so much. That's great. Do you have any key takeaway points for cardiologists in practice and for trainees that they can take back home and apply to their daily clinical practice?
The most recent European guidelines for chronic coronary syndrome recommend aspirin monotherapy as well as clopidogrel monotherapy in patients undergoing PCI as a lifelong management as class 1. However, in real-world practice, the aspirin monotherapy is much more prevailing than clopidogrel. Our Smart Choice 3 trial provided a new and robust evidence for clopidogrel monotherapy, especially when patients have high risk for recurrent ischemic events.
Thank you. Okay, so I have one last question for you. Do you have any advice for trainees to become as accomplished, as successful, and as big of a trialist and a clinician as you are?
Most important topic is what it means in the daily clinical practice. There are many room or gap between the guideline and textbook and the real practice. So, and I think we have to be more courageous for the new treatment.
Absolutely. Thank you so much, Dr. Hahn. We really do appreciate all the key insights that you provided on this great trial. I hope everyone takes away something and, is able to use it to their daily clinical practice. For more videos like this, please check out our channel at youtube.com/FITsOnTheGo. Thank you so much.
Thank you.
Thank you.